Welkom by vanaand se uitsending. Waldemar is in sy huis in die Kaap weens die inperking, maar hy sluit weer later in die program by ons aan. Ons blik bly hoeka vereers op die Kaap. Daar is 1079 positiewe COVID-toetsuitslae in die Wes-Kaap provinsie en 22 mense is reeds dood. So sê die Nasionale Departement van Gesondheid vanaand. Ek gesels nou met die premier van die Wes-Kaap, Winde. Premier Winde, you reported 5 deaths today. That's a disturbing number.
Ja, ons sien die syfer klim en ek dink dis hoekom ons so ondersteun vir die lockdown en ons eie syfers wys vir ons dat dis nog 'n lang pad om te gaan. We're going to reach 80,000 infections somewhere around about August just in 1 week. So ons probeer baie hard om hierdie geleentheid te gebruik om al ons gesondheidsmaatreëls in plek te sit, te sorg dat ons die beplanning het vir nuwe beddens. Ons moet sorg dat ons so maksimum reg kan wees vir die onslaught wat nog kom.
Premier, we know in Gauteng there are more cases, but per 100,000 residents, it seems as though in the Western Cape there actually is a higher prevalence of COVID-19. Do you have a reason for that?
Well, I don't know. I mean, obviously we ask ourselves the question, is it because we're testing more people? I think what we are doing is doing a lot of tracing. So as iemand inkom en sê, luister, ons het nou 'n positiewe saak gekry by 'n maatskappy, ons gaan in en ons toets almal in daai skof. And we've seen it in some factories. We've got one case and we've come back with 80 or 90 in that business, positive cases that obviously weren't showing any symptoms. The same thing in some of our retail front lines. So some of our big retailers will show 1 or 2 cases, and then we go in and we test, and we come back, and that grows to 20 or 30. And then we make sure there's protocols in place, and we've got to make sure that we close down, we clean, we make sure we test everyone. Those that are positive obviously get quarantined and isolated, and then we try to enable that business to bring on a new shift.
When do you expect the outbreak to peak in the Western Cape, and what's the state of the hospital's readiness in the province?
Okay, so our expected peak is in August. I think pretty similar to what Professor Karim was saying, maybe slightly earlier, but we're preparing obviously for our own measurements, the worst case scenario, and we know we've got a shortfall of around about 1,000 high care beds, and we've got 750 ICU beds too short or too few. The high care beds are much easier to put in place, and we've got a whole lot of plans, and we'll be rolling out what we call field hospitals. We should be able to put about 1,300 extra beds in place. The real conundrum for us is the 750 ICU beds. And we don't think we're going to make up. That is going to be our shortfall. So we've got to make sure we've got good practices in place. We've got to make sure that businesses, as we start to loosen up and open up, and I know that the Western Cape, probably the city of Cape Town, is still going to be a prime hotspot, Gauteng and KZN, the 3 provinces with the highest numbers. We're going to have proper business protocols in place to make sure that we can run our businesses without spreading the virus. And of course, we've noticed on all of our front lines, that's where we're picking them up at the moment during lockdown. So we know that will open it up, and we've got to be extra vigilant.
Just clarify a financial issue for our viewers. What is the responsibility of national government, and what is the province's responsibility? Just for example, with regard to the testing, does that come out of the province's pocket, the extra testing that you're doing?
Out of national, but we do have a huge quantity that also comes out of local, and we're still busy working on the numbers. We really welcome the extra 20 billion that's going to come now from national into the health system, and a fair amount will come from national into our system. But for example, opening up quarantine spaces and isolation spaces, it's been coming out of our pockets. We've been now with our public works department looking at those field hospitals. We've got to enter into those agreements. So it is from all spheres of government. And of course, we also know that we've got to reprioritize. And I don't know what those numbers are going to be, but if I take a guess, it's going to be in the 3 to 4 billion impact just on the province, where we've got to go and find money within our existing budget to reprioritize. So it's going to be tough for governments. We don't have the income that we were expecting, or that was part of our budget. That is definitely going to be greatly reduced. And of course, every sector is going to need support. So we do welcome the economic injection that's been put on the table last night. We've just got to get down to the numbers, how it's going to work, what the province's role is, and how much we are going to get. And then, of course, we've got to build those partnerships and make sure that where the economy can grow. For me, I think our real advantage, our two big employers in the region are agriculture and tourism. We know that tourism is going to take a longer while to get up and running, but I think agriculture is going to be our competitive edge. We really do export a lot of agricultural products, and I think with the rand where it is, we are going to have an advantage, and we need to maximize that advantage.
Just very shortly on the issue of safety, we've seen looting and riots in areas such as Mitchells Plain and Bonteheuwel. Do you fear an increase?
Absolutely. So a lot of the report, we have 3 cabinets a week where we get full reports across the spectrum of our work streams. But today we actually asked for an extra length to the report from the South African Police Services, as well as our own law enforcement that come out of our Joint Operations Command, as well as the police's command, their command center. It is a big issue for us. How do we get support to those specific trucks in hotspot areas? Can we put extra policing? There's also a question about how do we have convoys, or perhaps even support as police as these vehicles move into the hotspot areas to be much more vigilant. It is a big issue for me. And as well as not just the crime, we're taking away food from the poorest of the poor when we're looting and hijacking a truck that's on its way to take resources to people that really, really need it. And then also, when looting takes place, there's massive congregation again. And that again is a high infectious environment, and that again will spread the virus further. So I'm really concerned about it, and we have been engaging with SAPS and our law enforcement on how we can really up the intelligence to identify those hotspots and deal with the issues.
Premier Winde, thank you so much and good luck.